ILUVIEN's applicator has a 25-gauge needle. This produces a self-sealing wound, so there is no need for a tunneling procedure. ILUVIEN's injection is performed at 4 mm inferior temporal from the limbus. The mechanism of delivery of the implant does not involve a spring and therefore allows the physician to control the delivery of ILUVIEN into the posterior segment of the eye, where it settles in the vitreous and begins releasing fluocinolone acetonide, or FAC. One injection of ILUVIEN provides a sustained release of fluocinolone acetonide for up to 3 years. This is only possible due to the unique continuous microdosing technology of ILUVIEN. ILUVIEN is only 3.5 mm in length and 0.37 mm in diameter and is non-bioerodible. It has a volume which is approximately 1/10,000th of the total volume of the vitreous. ILUVIEN has a non-permeable cap at one end. The external wall of the implant is made from polyimide, an inert material used in intraocular lens haptics. At the other end is a permeable membrane made of polyvinyl alcohol, or PVA, that allows for the microscopic passage of fluocinolone acetonide. The internal part of the implant consists of a PVA matrix perfused with fluocinolone acetonide molecules. Let's take a deeper look at the mechanism of action. ILUVIEN's continuous microdosing technology is a function of the permeability of the PVA membrane. The diffusion coefficient of fluocinolone acetonide across the PVA membrane, which has a constant surface over time, and the chemical potential gradients of fluocinolone acetonide. There is a first gradient at the interface between the matrix and the reservoir of fluocinolone acetonide. When you zoom in, you can see how it works on the microscopic level. The fluocinolone acetonide solution in the reservoir reaches a saturation point, and there is a second gradient through the PVA membrane. Because we are at the saturation concentration, the two gradients are equal, which explains the sustained continuous release over time, which is only currently possible with a non-bioerodible technology. This is what happens during the first months of release of the FAC. As the saturation concentration and the surface of exchange with the vitreous remain stable over time, the sustained release is maintained for additional months. This remains true with the release of fluocinolone acetonide across the implant, allowing stable, continuous microdosing for up to 3 years. And this is possible with just one ILUVIEN implant.
Indication and important safety information. Indication: ILUVIEN, fluocinolone acetonide intravitreal implant, 0.19 mg, is indicated for the treatment of diabetic macular edema, DME, in patients who have been previously treated with a course of corticosteroids and did not have a clinically significant rise in intraocular pressure. Important safety information. Contraindications. ILUVIEN is contraindicated in patients with active or suspected ocular or periocular infections, including most viral diseases of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. ILUVIEN is contraindicated in patients with glaucoma who have cup-to-disc ratios of greater than 0.8. ILUVIEN is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injections, including those with ILUVIEN, have been associated with endophthalmitis, eye inflammation, increased intraocular pressure, and retinal detachments. Patients should be monitored following the intravitreal injection. Use of corticosteroids, including ILUVIEN, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development, ILUVIEN 82%, sham 50%, and intraocular pressure elevation of greater than or equal to 10 millimeters of mercury, ILUVIEN 34%, sham 10%.